You need to continue to think of yourself like many other nursing professionals today, not only as a caregiver but as a leader. You need to expand your view and your scope that you are a leader in healthcare, you are an advocate for your patient, you're an advocate for your nurses. You need to be open to all the different kinds of things that you can do and set those high goals for yourself. It's up to you. It's up to you and your peers. You have the opportunity with the things that are going on in healthcare today. You have the opportunity to have such a tremendous impact on nursing, on society, on healthcare.
And Wayne Gretzky used to say that you need to skate to where the puck is going and not where it's been. And I think that's so important for our up-and-coming scholars to think about this, because some of the things that historically have really mattered, especially in our academic environments, may not be as important in the future. Another piece of advice that I would give rising scholars is to make sure that you really choose a research trajectory that you can be passionate about. Because at the end of the day, if you can choose something as a scholar that you're passionate about, if you can choose a work that will have impact on nursing and healthcare, and if you can choose work that will really is something that you can be the best, the absolute best at doing this work, that's where you're really going to make a difference with your research.
First of all, and the most important message is you, whoever you are listening to this right now, you can make a difference. One person can make a difference. And if you just think to yourself that I personally have a stake in this, I'm passionate about what I do, and I'm going to make a difference, if we all think that, we are going to be able to do everything that we ever tried. Then I wanted to say that whenever you're trying to make decisions, it's not easy. It's hard to lead. It's hard to be a leader because everybody is not going to agree on everything. If you just do the right thing, that's got to be what your bottom line is. What is the right thing to do? If you get to what the right thing to do is, you're always going to make the right decision. Inaction is action. If you do not act, that has consequences. And so it's far better for you to act and then deal with the consequences than not act and have things just happen to you. Everything that we're talking about doing here in healthcare as nurses, and what we're talking about is not a small change. We're talking about a transformation of healthcare, and we want to be the leaders of that. It takes partnership and collaboration. We have to figure out ways that no matter who we're talking about, even if we've got sharp points of disagreement, that we find the ways that we can interface, we find the ways that we can collaborate, and we partner to create this better future that we know that we've got to have.
My advice would be get a mentor and choose your mentor wisely. But don't think you need to go out and do this on your own. Things happen better in teams, and it doesn't have to be a nurse necessarily. I enjoy working with nurses, but I enjoyed working with an interdisciplinary team. A lot of my colleagues are physicians and exercise physiologists, and we all bring something different to the table. So don't be afraid to say yes, but on the other hand, be very careful about saying yes. And then don't be afraid to say no to the other things. But Carol Picard, who was a former Sigma Theta Tau president, said something to me once, and it has stuck with me, and that is opportunity is a brief visitor. So when those opportunities arise, say yes, if it's the right thing for you. If it appeals to you, if it matches your research interests, your leadership goals, then say yes.
Most trusted profession, except for 9/11, is nurses. And I don't think we have understood. We have swagger. We have swag. There are 3 million RNs, and if we can get ourselves, advanced practice nurses as well, but if we can identify 1 or 2 issues that we all see around this country, this is what we are, this is what we do, I'm going to lobby my congressperson, and we're going to make this happen not for nursing, but for advancing health of this nation, for those patients and those caregivers, no matter where they are, we can do it.
I would say to each person to trust the process of their journey. One benefit of getting older is that you can see how your life has unfolded. You can see that you have prepared for leadership or some opportunity by doing things that you didn't understand at the time. Once you get older, you see, I've prepared my whole life for this, but I didn't know it when I was doing that role or that job or preparing on that research team or teaching that particular course. It all adds up to make sense. That's one of the joys of getting older, is to see that it actually does make sense. So my advice is to trust that that is happening, that your authentic life is unfolding as it should, and that if we show up and we're present and we're authentically engaged in our work, it's the right place to be.